combating nutrition disinformation and general bull. It's Jimmy Rants. JimmyRants.com.
What's up, you guys? Welcome back to another Instagram Live. And we're here with another episode of Jimmy Rants. So if you're brand new to the Jimmy Rants concept, we've been doing this for a few months now, but the way it works is go to JimmyRants.com and you can see that we start off on Instagram Live. So go follow me at Livin' Low Carb Man, LIVINLOWCARBMAN, and you can join live just like Keto Neogenesis and Keto Naughty and Kitty Caddick, Grandma Does Keto, Keto Coach Lauren. All my usual suspects are here early today. Thank you guys for being here. You can also watch it up to 24 hours on replay. So that's why you need to go follow me on Instagram. But then we pop it on over to YouTube that you can watch it forever and ever. Amen. We have all the past episodes up on YouTube. So go look up Jimmy Rants in a search there and you will find we have over 100 episodes now for your enjoyment. And then finally we have a Jimmy Rants podcast that you can listen to on Apple Podcasts. Go write us a review there if you like it. But we do the best of the best moments of this here show. Again, it's all at JimmyRants.com. Today's Jimmy Rants topic is all about doctors. We like to go see our doctors when we're not feeling well, or if we break our arm, or if we have some other what's called acute condition. Acute meaning needs to be dealt with very quickly. So if you broke your arm, if you cut yourself deeply and you need stitches, if you have a heart attack and you have to go to the hospital, any number of things that are acutely happening, you want the medical care system and doctors to take care of you. And they do a very good job of taking care of these acute issues that pop up in our lives. Okay, so this is not anti-doctor, so don't misrepresent me today or mishear me thinking that I'm against doctors. But I do have to ask a very important question. And that question is this: why are we so trusting of doctors when it comes to chronic diseases? So what's a chronic disease? The diseases of civilization is how we put it in our book, The Keto Cure. And we're looking at type 2 diabetes. We're looking at heart disease. We're looking at pretty much anything that would be related to your diet and your lifestyle. And these are things that can pop up over decades of you living and then suddenly manifest as symptoms. But they don't just happen overnight. So why do we trust doctors to deal with these chronic diseases? Because at the end of the day, doctors really haven't been trained very well when it comes to nutrition, when it comes to lifestyle issues. Even when you talk about things like micronutrients, vitamins and minerals. Christine, my wife, went to see her doctor about a month and a half ago, and she talked to the PA. The PA was fresh out of medical school over the past couple of years, and there was something awry in her potassium levels on the test. And so Christine's like, well, we know that this other micronutrient actually helps to counterbalance when potassium is too low, this kind of counterbalance. And the girl had no idea what Christine was talking about. And so this is a problem, guys, that if doctors and medical professionals and people that are seeing patients on a daily basis who are coming into their offices are not fully educated on all the latest information as it relates to the role of nutrition and lifestyle on people's health, are they really helping people? And a friend of mine texted me earlier today about her mom, and her mom got the bejeebies scared out of her because her doctor thought her cholesterol was too high. And so total cholesterol was something like 270 something. And so they put her on the highest dose of statin medication that they possibly could. Highest dose, 80 milligrams of Lipitor, okay? 80 milligrams of Lipitor. The lady's in her 50s, and they're putting her on 80 milligrams of Lipitor. So I asked this friend who texted me what her mom's triglycerides and HDL were. Want to guess? Her trigs were under 50. Her HDL was over 80. And so here you have this triglyceride to HDL ratio, which is stellar, and yet her doctor, no lie, called her into the office, actually called her on the phone and said, you need to come into the office and get a statin drug prescription as soon as possible, or tomorrow you will die of a heart attack. No kidding. It's exactly what she said. That's disgusting to me. And yet doctors, they do this kind of thing where they look at a high cholesterol, for example, and don't get me started on cholesterol, and they think that suddenly this patient's going to be at great risk of heart disease. How do they know? With those stellar numbers that she had in her triglycerides and her HDL, it's obvious she's in a lot better metabolic health than someone, for example, who has a 300 total cholesterol, but their LDL is 280 of that. Their HDL is basically nothing, 10. Their triglycerides are over 1,000. That's somebody that's in really bad shape. And yet we're so trusting of doctors, and doctors play a role in this, you guys, when they manipulate patients and they use language like you will die if, this is going to prevent, which, by the way, the statin in that case ain't going to prevent a heart attack. It's actually going to raise the risk of having a heart attack. I've talked about this before on other Jimmy rants, and I wrote about it in my book, Cholesterol Clarity, if you want to learn more. But it's pretty sad when doctors are ill-equipped to be able to help the health of their patients in a preventative measure when it comes to the development of these chronic diseases. And you got to give them a little bit of slack because they haven't been taught. It wasn't in their medical school training. It wasn't in any kind of formalized, this is what you should do for diabetes. This is what you should do for heart disease, other than pharmacological responses. And you as a patient need to know this stuff. Because if you go into the office thinking your doctor is up on all the latest nutritional health science and all the latest lifestyle things like infrared sauna and doing like HIIT training and light therapy, and they don't know a darn thing about any of that stuff, okay? This is where I often talk about you taking back control of your own health, because doctors don't have the knowledge to be able to help you do that. That's why you have to do it. It's why you watch me on this Jimmy Rants. It's why you keep educating yourself. It's why you listen to podcasts and you read books, because you're trying to learn so that you can help yourself and the people in your life that you love. So the bottom line in this Jimmy Rants is, why are we so trusting of doctors on chronic diseases when they really don't know all of the answers when it comes to nutrition and lifestyle that could truly help prevent chronic diseases from taking place? All right, so let's see what you guys have to say. Welcome in, welcome in. Hello, Lauren. Thanks for being here. I knew you'd like this topic, Lauren. Hello, Beth. Caught you live, and I'm not driving. Win-win. Good job. Hello, Keisha. Thanks for being here. Hello, Frisk T. Live. Time for my afternoon Jimmy happy time. Awesome, Nancy. Thank you for that. Hello, Bonnie Lene. Hello from Norway. Hello, Lilla Grand. Hello, Griff Sam. Episode 150 yet? Not yet. Give me a couple of days, Sam. I'll get there. If you missed it, yesterday was episode 100, and I had an epic giveaway. So thank you to everybody who entered. I got a lot of books to ship now, you guys. So thank you for your responses. Hello, Russ. Thanks for being here. They do not know anything about nutrition and live. That's true. Medical doctors don't, unless they learned it on their own. There are a lot that are starting to learn it on their own. I'm very encouraged by some of the younger generation of doctors that are taking the time to learn it on their own, but unfortunately, they weren't given it within a formalized educational setting in med school. Hey, Jessica Ty, everybody go follow that keto blonde. She's awesome. White coat syndrome, Jessica says. Yes, Jessica, sadly. And it's of a certain generation. I'm in Gen X generation. Gen X, it's kind of a mix in Gen X because there's a lot of Gen Xers that are still very trusting of doctors because the baby boomers who were their parents were very trusting of doctors. It's the millennials that I kind of have a kindredship to in this realm. They question everything, and I'm kind of in that same camp. Since my eyes have been opened to the reality of where we are in our health and nutrition system and how things work, I'm so skeptical of really everything when it comes to chronic disease and doctors. Hello, BB. Thanks for being here. Hello, Wanda. Welcome in, you guys. Beth says, this may be completely judgmental on my part, but I think people get lazy and pass the knowledge buck to someone else. When they fail, the blame is on someone else. Well, Beth, that's an interesting theory. I don't think people consciously just pass the buck, though. I think they honestly, in their heart of hearts, think that their doctor has all the answers when it comes to their health. Meaning they also know what the best diet is, meaning they also know what the best kind of lifestyle factors and things that can help with any given disease. And yet most doctors, when you start talking about type 2 diabetes, what's the first thing they're doing? They're going to their prescription pad and they're writing you a prescription for metformin. They're not saying go cut the carbs out of your diet. They're not saying eat more healthy fats. They're not saying do things to control your blood sugar. They're going to the default of what they learned, and what they learned was pharmacological. Okay? So I don't think people are necessarily saying that they're just going to just let someone else make the decisions and it's on them if something happens to me. I just don't think people know because the doctor isn't saying, well, you know, I've heard that there's some nutritional stuff that you can do that could help control your blood sugar, but I don't really know anything about it. Maybe you can go learn it on your own. No, doctors are not telling patients to go try to learn this stuff. That's why people follow people like me, is I'm sharing this info and I'm hoping as many people as possible that need to hear the message, hear the message. I said I might have malaria, and Triage says, how do you spell malaria? Steph, you are a funny one. Katarina says chronic diseases are a major money maker. Pharma, well aware of that, and they sponsor and provide textbooks for doctors. Yeah, the big bugaboo in all of this is the pharmaceutical industry, because they do flood you guys tons of money to doctors, and they flood billions of dollars into marketing heavily their drugs and to getting ask your doctor. You know, anytime you watch a drug ad, it always says ask your doctor. Well, then they have pharmaceutical reps that go and talk to those doctors, and they give them incentives. Hey, put Wonder Drug on everybody and we'll incentivize you. We'll help pay for that big fancy schmancy vacation you want. I hate to sound jaded like that, but I've talked to enough doctors behind the scenes. That's exactly what's happening, you guys. And Kat is right. These procedures and these pharmaceutical drugs that treat the chronic diseases, they're big time money makers. Before the patent ran out on the statin drugs, the cholesterol lowering meds, Lipitor, Crestor, and all those kind of cholesterol lowering medications, they made $29 billion annually. $29 billion. And so big time money being made on this illusion that high cholesterol is a disease. It's not, by the way. And I've talked about that on previous Jimmy Rants. There's no excuse, especially for the medical community, to not know how to help keep us healthy. I distrust most medical providers in regards to health. Broken bone, yes, then go to the doctor. Yeah, if I break my arm, I'm going to go see a medical doctor. If I have elevated blood pressure, elevated blood sugar, elevated insulin levels, I don't want to know what they think about how to fix those things, because unfortunately, they alone do not have all the answers. This is where a functional medicine practitioner could come into play, maybe a naturopath, maybe someone who's advanced in their training when it comes to nutrition, like a nutritional therapy practitioner or an educated dietitian, that kind of thing. Hello, Ashton. Thanks for being here. There's no excuse for lay people either. Information and results are there for the taking. Yeah, Beth, I feel you on that one, because you would think with all the advent of technology that's out there that people could get the information. But then you got people like my dad. My dad has never, ever, shocker, been on the internet before. Like, ever. And he's in his late 60s. He's never, ever been on the internet. The only thing he knows about his son of what I do for a living is I write books, because he gets all my books when they come out. But he's never been on the internet. So how does he have access to the information? And he lives in a little small town in Tennessee. So where would he hear about this information but for the internet? But if he's not on the internet, how would he get it? But you're right. If you're wanting to learn, the internet is full of some incredible information, incredible bad information, along with incredible good information. So you kind of have to sift through it. But it is there for the taking if you want to learn. The knowledge doctors are getting is sometimes misleading. Yeah, it sure is, Kat. Bonnie Lene, scare tactics. That's really, it's sad in that particular case with my friend that texted me. It's sad that they feel like they have to do those things of, you're going to die tomorrow if you don't come in and get this prescription for this med. That's irresponsible, in my opinion. Doctors are forced to follow ADA rules or they'll take their license away. Bonnie Lene, you're talking about something called standard of care. And if you missed my podcast today on the Livin' La Vida Low Carb Show, go listen to thelivinlowcarbshow.com or go find it on Apple Podcasts, wherever you listen to podcasts, the Livin' La Vida Low Carb Show. My episode today, we're still airing episodes from the low carb cruise from earlier this year. And Dr. Ken Berry was the guest today that gave his lecture. And in there, he talks about this whole standard of care thing, that doctors do get in trouble if they don't follow specific guidelines. So that is something that's a little bit tricky. But that doesn't answer the question of why we trust doctors on chronic disease. It explains why they promote drugs and why they don't promote some medication or some non-medical thing like real food or lifestyle types of things. But go listen to that, you guys. It's a shame they have to do these scare tactics. Ashton, I agree. It's unnecessary. But again, maybe they needed to meet their quota for number of people they put on a statin that month, and they would have got a bonus. So, I mean, who knows what motivates them to do that? Bonnie Lene, holistic education is better to me. They're more open-minded. Yeah, if you can find a holistic or a functional medicine doctor, they're definitely going to look at the root cause of what's going on and not just the symptoms. Keto Neogenesis, I'll give them slack when they hold my stethoscope while I check real resources. Lauren says, knowledge is power all day, every day. It's what I try to impart upon you guys when I come on these Jimmy rants. But people, real people, are learning stuff online. And there's a battle online, you guys, whether you know it or not. And I talked about this quite a bit. My Instagram was deleted right at about a month and a half, 2 months ago. My Wikipedia page is now up for deletion. There is a war afoot, and it's not just against me. It's other people within this field. Afoot to try to silence those of us that are speaking out against the conventional wisdom. So you have to realize that's going on behind the scenes, because they know that the work we're doing is making a difference. So if they think they're going to shut me up, they really don't know me very well. The Mindful Mirror says, I asked my doctor to learn more about cholesterol levels and testing inflammation. She flat out refused. I gave her a chance. Next. I love it. And that's not uncommon either. I tried to get my doctor to run a fasting insulin level. I am insulin resistant. So that's one number that I tend to keep an eye on is my fasting insulin. And it's slightly elevated above what I would love for it to be. It's somewhere around 13, 14. Ideally, you want it to be in the single digits, definitely under 5 if you're trying to optimize your health. And mine's 13, 14. So I try to keep an eye on it so it doesn't get out of control. And yet my doctor, last time I went in, he said, oh, your insulin's fine. I'm like, no, it's not fine. I want to have it run. He flat out refused, and I flat out fired his butt. That's what you got to do. And you can run all these tests on your own, by the way, now. Any lab tests now. I use this one called privatemdlabs.com, where you can go on there, and in all but like 3 or 4 states, you can order your own test, pretty much any test you want. It's all out of pocket, although health savings account, it does cover these expenses. So if you have an HSA, you can pay for these tests on your own. And you go down to the local LabCorp, they pull the blood, and within a few days in your email, you get the results of your test. Now, obviously, if it's an advanced test and you need some help interpreting what it means, then you'll need a medical professional to help. But to just run and keep an eye on some number just to see how you're doing, that's what I have to do now with my insulin, is I run it through Private MD Labs so I can keep tabs of it. Sadly, doctors rely a lot on what the pharmaceutical reps tell them. Nancy, you're right. And I've even asked if I could present a presentation to my local doctor's office on keto and how it could help with a variety of conditions. Obviously, I've written a lot of books about this. I can articulate it in very easy to understand language. I can also articulate the science to show them the veracity of it. And they flat out said no. And I'm going, well, wait a minute. You let these pharmaceutical reps come in here, bring you boxes of donuts, and peddle some drug that's supposed to be the cure-all for some disease that your patients are seeing. Wouldn't you like to have a non-drug option to show for these exact same diseases? And I'll bring you bacon, and I'll bring you fresh eggs from my backyard chickens, and you can eat healthier. But no, they're not interested in that. And you're right, they do trust what these pharmaceutical reps tell them. And still, majority don't want to change eating habits, do any of the lifestyle stuff. Some just want the magic pill. Cat, that is where we are too. I do sense that's changing, but there are always going to be people that want a shortcut. Hello, Darla. You found me. Darla earlier said, when are you going live? I hadn't seen you live in days. I'm like, I'm on here every day. So I'm glad you caught me live, Darla. Hello, Joette. Yeah, Beth, you missed a giveaway yesterday. It was a big one, too. Hello, Olga. We were always taught to respect the advice of doctors. I always thought they were up to date on the scientific findings. Everybody does. It's one reason I wanted to do this Jimmy Rants today is we have become so trusting of doctors because of this illusion that they have all of the knowledge when it comes to everything about your health. And the big gap in their knowledge is about nutrition and lifestyle. They just don't know because they weren't taught. I believe Western American med is perfect for acute episodes, but for chronic education is key. It's a lifestyle road. No one but you knows your body. Bioindividual. I said exactly those words at the very beginning of this rant, so thank you for articulating that again. Hello, Ume. Thanks for being here. Hello, Lau. I was born in 1978, and I question everything. Yes. You're just like me. Doctors ask me if I'm a medical professional because of my vocabulary at appointments. Yeah, it's so funny. When I go see medical people, I'm so used to, on my podcast, calling medical doctors by their first name that, hey, Tony, what's going on? And it's like Dr. whatever, Smith. And you can tell it kind of, because everybody calls them doctor all the time, but I'm saying, hey, what's up, Tony? You know, and not that I'm trying to disrespect the medical education, but I'm just so used to talking to doctors. And yeah, I can talk the lingo with them as well. I live in rural Iowa with country doctors. Surprisingly, most at the hospital are on keto or at least know about it. Joshua, I'm not surprised. I think in the smaller areas, and think about Dr. Barry. Dr. Ken Barry lives in Camden, Tennessee. Camden, I used to live in Tennessee. Camden is a little podunk little town, so out in the middle of nowhere. And here's this doctor who understands keto and understands it abundantly and is using it to help his patients. So I'm not surprised. An apple a day keeps the doctor employed, says Olga. Yeah, that's a good one. Doctors get offended if we ask them questions or tell them our opinion. And Reham, Reham, I think that's a big problem because doctors do not need to be threatened by an educated patient. They need to be thankful for an educated patient, because a lot of doctors that get their eyes opened to this way of eating of keto and low carb, a lot of those doctors that have had their eyes open is because a patient came in sharing their experiences, sharing their knowledge, sharing how it's changed their life. So a good doctor would be like, whoa, this is information I haven't heard before. Or, wow, this patient's very educated, asking me a question I haven't really been normally asked before. So they shouldn't get offended, but you're right. There is a certain segment, especially of the older generation of doctors, that do not want to be questioned on anything. And if you question their advice, there's something wrong with you and you're a non-compliant patient, and they'll ding you on your file. Those are the people that you got to go, bye-bye. Thank you for the ebook, Jimmy. You're welcome, Lilla Grand. Great topic. I'm all riled up now, LOL. We have to be the sentries to spread the word and live by example. Beth, that's right. That's exactly what we need to do. Steph says, my doc hasn't even mentioned a statin despite my total cholesterol being over 400. Triglyceride to HDL and remnant LDL are beautiful. And that's a good thing. We'll use the keto cure to try again to persuade members of my family to reconsider taking statins and eating keto. Yeah, use resources. There's so many now that are out there, not just my books, but a lot of people are writing about these things that you can use in your artillery of trying to educate them all about this. My doc wants to send me to an endocrinologist. I said, okay, because I found out this endo knows Jason Fung. Oh, okay. Maybe he's enlightened a bit. Yes, my dad is a dinosaur, Beth. Thank you for that. He has been. He's like a 90-year-old man in a 60-something-year-old body. The mindful mirror, some people don't have the resources, emotional or practical, to wade through all the info and change their lifestyle drastically. Some people don't even have access to grocery stores. This is true. We've been programmed culturally to accept cultural norms. We shame each other when we deviate from the norms. Talking about health and nutrition is like talking about politics. Sadly, that's true, although I think politics is far more vitriolic than even diet. But just tell people you're fasting. That's all you got to do. Just tell people, yeah, I've decided to fast today. I'm not going to eat anything at all. You have a World War III on your hands, because people think you're starving yourself and they think you're going to cause harm to yourself. You need to eat or you're going to die and all this stuff. So we trust them because we tend to believe in authority regardless of background or expertise, the white coat phenomenon. Yes, Grandma does keto. That is why we're so trusting of doctors on chronic disease. The flip side is that many patients will not follow common sense medical advice if they don't like it. Physicians know this and they just give up. Yeah, because it's frustration of knowing that they've tried things and failed, tried things and failed, tried things and failed. Why do they want to try the next thing? Please post a link to the lab for self-testing on your Facebook page. Well, I'll tell you one more time. If you'll listen very carefully, it's very easy to remember. Anylabtestnow.com. They also have, and this is in America, for my international friends, sorry about that. I don't know what it is in your country, but in America, anylabtestnow.com, and they actually have little clinics set up all over the United States. So if you go to anylabtestnow.com, they'll show you where a clinic is locally that you could go and do it, or you could order online. The one that I use is one called privatemdlabs.com. privatemdlabs.com. I'm not affiliated with either one of these companies, but they both do lab testing for pretty much any lab test that you need. They can take care of you. Even the nephrologist my mother visits refuses to recommend keto. He just juggles a bunch of pills. Her kidneys are messed up due to type 2 diabetes, and she takes these pills that's not healing what's going on in her kidneys. So that's the sad part, Olga. I hope she gets help sooner than later. Alberto, it's like math. I took so many complicated math classes that at some point I forgot the basics, like a simple division. Same thing happens to a doctor. Yeah, I think, Alberto, you're onto something there, that sometimes doctors enjoy the complexity of the medical field, that they try to find the complexity in it when sometimes the answer is super simple. BB, thank you for your question, but that's off topic. So if you have, if you want to drop me that as a message on Instagram, I'm happy to answer. I think younger doctors don't mind being called by their first name. Keto Nana, no, they do not. In fact, I remember Dr. Eric Westman, my co-author on cholesterol clarity and keto clarity. Forever, I would call him Dr. Westman, Dr. Westman, Dr. Westman. It was always respect, because I grew up told to respect the medical profession. One day, Dr. Westman said, "Will you please call me Eric?" So ever since that day, I call him Eric. In fact, I interviewed Eric the other day for an upcoming episode in early January of the Living La Vida Low Carb show. And I said, and today we have Dr. Eric Westman, but I ain't calling him Dr. Westman. He's Eric to me. And so that's kind of our inside joke now. Ideal, when I ask for blood work, MD says, why go looking for things that might cause us to explore more, which can come with risks? And that's crazy to me, Christopher, that you want to run tests to see how things are going, and the doctor's like, well, why you want to like noodle around to find something? You want to find something before it turns into something, right? Tyler says, Dr. Ken Berry amazes me, a doctor who used to preach purchased advice that current doctors teach today and now spends time speaking against it. Need more doctors like him. Yeah, Ken is a trailblazer. I think he is the rising star in keto right now. Guys, pay attention to him, because Dr. Berry, he's got a book called Lies My Doctor Told Me. You can go get right now on Amazon. But his new book coming in March called Common Sense Keto, Johnny bar the door. It's going to open a lot of eyes for hopefully a lot of people in the medical profession. Gastric bypass doctors are the worst, says Crystal. Yeah, and they're not wrong when they say if you have gastric bypass surgery, it can tend to not just deal with obesity, but also help to improve diabetes risk as well as type 2 diabetes if you have it, because it does lower blood sugar in the short term. But over the long term, if nutrition doesn't change and lifestyle things don't change, you can be right back where you started from. My mom experienced that. My doc is cautiously optimistic about my health. High LDL, but A1C is 4.3, which is very good, guys. CRP and HSCRP are perfect, so on. He's leery, hence the endocrinologist. See, it's just disgusting to me. You can have an A1C of 4.3, which that's blood sugar, you guys, like in the 70s. It's like stellar, like constant blood sugar in the 70s. Unbelievably good, Steph. And sad that he's giving you a hard time just because you have high LDL. I love your and Dr. Berry's style. It digs deep and it's easy to understand. Even the complex topics, a mark of a great teacher is the ability to make something or to be able to reach the most people and then help them understand. Thank you for that, Beth. I'm Generation X, but my mom brought me up to be skeptical about doctors, which has served me well. Lilla Grand, good job. Both of my doctors are a little more open about diet and homeopathic treatments. Keto 995, that is very rare in a traditionally trained medical doctor, so don't ever lose that doctor. Steph Lynn, 1977, I just automatically used to believe what they said, so that's why 25 years later, I'm still going in circles, getting nowhere. Well, Steph, welcome to the educated public empowered patient club because we're all trying to learn from each other so that when we do go see the doctor, and here's the other thing, you guys, you go see the doctor, he ain't the boss. He or she is not the boss in that relationship. You are. And I've talked about this before on another Jimmy Rants, but you're the one that makes the choices about what to do in your health, not the doctor. The doctor is merely a consultant in your health. And if you treat them like a consultant, just like a business would treat a consultant in their business, do they hand over the reins of the business to those consultants? No. What they do is they say, okay, what do you see? And then they give their feedback. And then based on that feedback, the CEO and all the executive staff of the company then makes the decision about what to do for their business. Well, the same goes for your health. You get the doctor to be a consultant, tells you kind of their assessment. They may throw in a few opinions about what they think you should do. But at the end of the day, you decide what to do, not that doctor. I'm starting to finally open my eyes from watching you and Kim Berry. Thank you, Steph. I'm blessed to have a keto doctor. I love him. He's helping me get off the meds. That's awesome, Sherry. Keep that doctor too. Looking forward to the new season of you and Dr. Will Cole. Thank you, Christopher. We are coming back in the first week of January with Keto Talk with Jimmy Moore and Dr. Will Cole. My MD is so happy for me. She put in my chart in 3 places that keto is working well. Sue B367, that is just awesome. Hello, Kat, my low-carb path. You are the consumer, not the victim. You're ultimately in charge of your own health. That is exactly right. So, guys, the bottom line in this Jimmy Rants, I hope you got it. Why are we so trusting of doctors on chronic disease? We don't need to be. They're very good at acute disease. If you break your arm, if you cut your leg and you need to have it stitched up, if you've got some other acute thing that you need to have the medical system deal with, then they're very good at that. But if there's something in your life that's chronic, type 2 diabetes, heart disease, even cancer and some of the other things that are out there that could be related to your diet and lifestyle, why are we thinking that doctors have the answers to that? They haven't been trained in it. They don't know about it. And so if they don't know about it, we don't need to be so trusting of them. And instead, we need to seek out those people that have good information that could help us on the journey to better health. All right, guys, that's it for this Jimmy Rants. JimmyRants.com is the website. And if you're brand new to the show, we start off over on Instagram. So if you're not following me there, go to @LivinLowCarbMan, LivinLowCarbman. And once you're done following me, I come on twice a day to do lives. So follow me there. You can engage in the content. Really active discussion today, you guys. Thank you for that. Then you can watch the replay for up to 24 hours. Then we pop it on over to YouTube where it stays forever. So go look up Jimmy Rants on YouTube. You can find all my past rants and then the all-new Jimmy Rants podcast where we have the best of the best moments of this here show. And if you like what you hear, definitely go leave us a review over on Apple Podcasts. It really helps out brand new shows. JimmyRants.com, you guys, is the website. And guys, until next time, we'll see you then.